The flu can affect people of all ages. Influenza particularly impacts throat, nose, and lungs, and the symptoms can include fever, cough, sore throat, runny, stuffy nose, muscle and body aches, headaches, and fatigue. Most likely, flu is spread when people talk, sneeze, or cough, and the flu droplets spread. Someone with the flu can infect others anywhere from 1 day before symptoms show to 5 to 7 days after expecting flu illness. Those with medical conditions or the elderly have a higher chance of developing a more severe condition. But the real question on everyone's mind: from the beginning of this year, close to 145 million doses of the flu vaccine have been distributed weekly to Americans. Overall, the number of people who receive a flu vaccine increases with age after age 17. According to the CDC, in 2015, roughly 50% of children ages 6 months to 17 years, 32% of 18 to 49-year-olds, 48% of 50 to 64-year-olds, and 70% of those 65 and older received the vaccine. There are different types of flu vaccines that exist rather than just one overall vaccine, with different types of vaccines suggested for those of different age groups. The flu virus is composed of 8 string-like segments called RNA, which are genes that encode the virus. Proteins surround the DNA, and these proteins are involved in drift and are called hemagglutinin and neuraminidase. Hemagglutinin has 16 subtypes, and neuraminidase has 9 subtypes. These subtypes are used to name influenza A viruses. If a person has received the flu vaccine, antibodies then attach to the hemagglutinin proteins so that it can't affect the cells in the body, trying to prevent the spread. If there is no vaccine, then the hemagglutinin part of the virus will engage with sugars that are located on the outside of the cells, creating a bond that then enables the virus to go into the cell. These influenza viruses will mutate upon replication, changing the hemagglutinin and neuraminidase. As the virus spreads, it shifts, causing the flu vaccine to no longer work because the vaccine no longer corresponds to the hemagglutinin. As a result, new flu vaccines must be made each year with the intention of the strand of the virus predicted to be the worst, a prediction which scientists are usually very successful at undertaking. The question of whether or not to receive the flu vaccine is one that millions of people face each year, as much controversy exists as to whether or not the flu vaccine is actually effective. One reason for this controversy might be the fact that some who have received a flu shot have also still been diagnosed with the flu, leading to the myth that the flu vaccine can actually give a recipient the flu itself. Also, with the virus, and thus the flu vaccine, changing each year, it is not even guaranteed that the administered shot will protect you against the flu in the first place. However, the flu each year still results in close to 31.4 million outpatient visits, 200,000 hospitalizations, and anywhere from 3,000 to 49,000 deaths. Specifically, from 2013 to 2014, adults aged 18 to 64 accounted for almost 60% of these flu hospitalizations. Regardless of the skepticism, the flu shot is still effective. For instance, one study was conducted in St. Paul, Minnesota, assessing the effectiveness of the flu vaccine in healthy, working adults, specifically monitoring the number of upper respiratory illnesses, days missed from work due to sickness, and use of any health care aid. The participants accepted in the study included anyone aged 18 to 64 of the St. Paul area with full employment and no medical conditions that would otherwise contribute greater to developing influenza. Participants then either received the flu vaccine or a placebo based on computer randomization. Phone interviews and surveys were then conducted to receive updates on the patients and their symptoms at different times afterward the initial administration of the vaccine, where up to 5 different interviews were directed per participant. As a result, it was found that those who received the vaccine and not the placebo had fewer missed days from work and fewer trips to receive medical assistance. Specifically, a decrease of upper respiratory illness by 25% was seen with the vaccination. A decrease of days missed from work because of upper respiratory illness was seen by 43%. A decrease of days missed from work because of any illness was seen by 36%. And a decrease of trips made to see a doctor was seen by 44%. Even more, another study conducted in Baltimore also revealed the effectiveness of the flu vaccine, where only 1.7% of healthcare professionals who received the flu vaccine got the flu, rather than 13.4% of healthcare professionals who received a placebo, further confirming that the flu shot is in fact effective. So where should we go from here? There are 2 questions that still remain. 1. Is there an alternative to the flu vaccine that could be taken instead to minimize the controversy? And 2, should the flu shot be mandated? These topics are still up for debate, so what do you think?